Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Tuesday, December 1st. We are joined today by Yukon Premier, the Honourable Sandy Silver, and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpreter, Mary Thiessen, and André Boursier from the French Language Services Directorate are also with us today. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having a problem, please email ecoinfo@gov.yk.ca. Premier Silver.
Thank you very much, Pat. Hello, everybody, and thank you for joining myself and Dr. Hanley on the traditional territory of the Kwantlen First Nation and the T'an Council. In the past week, we have announced 8 new cases of COVID-19. We now have a total of 47 cases in the territory and a total of 17 active cases. We have also issued additional public notifications over the past few days. I encourage all Yukoners to review the public notifications so that they know if they've been in a location where they may have been at risk of exposure. Anyone who has symptoms should self-isolate or arrange for testing at the COVID-19 Testing and Assessment Center at 867-393-3083 or through the Rural Community Health Center. Once again, I want to stress how important it is to practice the Safe 6. They are still the best thing that you can do to keep yourself and others safe. Wash your hands often, maintain physical distancing, staying at home if you're sick, traveling responsibly and respectfully, both with inside and outside of the territory, self-isolate as required, and follow gathering guidelines that are in place, including limiting indoor gatherings to 10 people. By practicing the Safe 6, you can help keep all Yukoners safe, and there is more that you can do. As we announced last week, masks are now mandatory in all indoor public spaces throughout the Yukon for those over the age of 5 years old. By indoor public spaces, we are referring to indoor areas of a building that are intended for the common use of the whole public. Now, this includes public buildings, stores, lobbies, hallways, waiting rooms, public bathrooms, elevators, and other indoor spaces. Mask use can help reduce the risk of an infected person passing the virus along to someone else, and wearing them can protect people from being infected. However, like seatbelts and bike helmets, masks are only effective when you wear one. My simple advice, if you're not sure whether or not you're in a public space, wear a mask. Do it for your neighbors, do it for your friends, and for your colleagues. We cannot let our guard down, and we must remain vigilant. I also want to take some time to emphasize the importance of staying home if you are sick. As we deal with the second wave of this pandemic, it's very important to be mindful of what we are each doing to prevent the spread of COVID-19. It is important to monitor your symptoms and to stay at home if you are sick. I know Yukoners take their work very seriously, and it's not easy to stay away, but it is very important. Across the territory, workplaces have done a lot of work to adapt to COVID-19 and to put in place safety protocols. It has been great to see the quick and creative changes that local businesses and organizations have made to keep their operations safe and healthy. We can't thank you enough. As we face the second wave, it is a good idea to review optional plans and ensure that you're doing everything you can to keep your businesses safe and sanitary. The best way to prevent spread at the workplace is to stay at home if you're not feeling well. I want all Yukon employers and employees to know that they are supported in this. Our government has paid sick leave rebate program for employers, including those who are self-employed. To complement this, under new COVID-19 regulations, an employee is also entitled to a leave without pay for a period of up to 14 days if they require it. an employee can use this leave if they or someone in their care is ordered to follow a health protection measure such as self-isolating. Now, you can find more information about this support and others at yukon.ca. The length of these leave provisions align with the recommendations of how long people must self-isolate because they have developed symptoms or are at risk due to contact with the virus. Now, to reduce the strain on the healthcare system and to further limit exposure, a doctor's note is required to access this leave. So please, take the precautions and stay home if you are feeling sick. Doing so will ensure that we can continue to work in safe, healthy places. Also, if you are in a position to work from home, please do so. We need to take care, extra care, to limit our interactions with those outside of our bubble as we experience the second wave and spend more time indoors. I know that Dr. Hanley will have more to say about bubbles and social interactions in a moment, but I want to remind people, of course, as goes without saying sometimes, that these are extremely challenging times, and there's no denying that. And I know that it's not easy to hunker down and to keep to ourselves after all that we've been through since the spring. We need to continue to support one another and to check in on one another. And to do so, we do all that we can to help out each other when we see people in need. We will get through this together, and we'll get through this together with patience and with kindness. There are some hopeful sights on the horizon, including the prospects of effective vaccines. I want to update all Yukoners on where we are with respect to vaccines. Last week, I had a frank discussion with my fellow premiers and the Prime Minister about a national approach to vaccine delivery. We discussed the importance of waiting for regulatory approval before giving out vaccines, as well as providing additional information to Canadians as it becomes available. I continue to stress the importance of fair and equitable access to the vaccine and vaccines, including for key populations that are high risk, such as long-term care residents, elder populations, immunocompromised individuals, healthcare workers, and Indigenous, remote, and northern communities. My colleagues and I understand that this will be the most complicated immunization program ever delivered in Canada, and that we need to take a Team Canada approach, working with other provinces and territories on approvals, on timing, procurement, distribution, and costs. Many details are still being finalized, including the number of doses that will be available and the timelines for rolling out the vaccines across Canada. A national operations centre is being established to coordinate the logistics and distribution of vaccines, and the Canadian Armed Forces are helping with planning, data sharing, and supporting Indigenous and rural communities. Yukon's Emergency Measures Organization has been in contact with Brigadier General Carpentinier of the Joint Task Force North to build planning capacity for distribution in the North. The federal government is acquiring and distributing equipment as needed to accommodate vaccine delivery, including 26 ultra-cold temperature freezers to store candidate vaccines. Minister Pauline Frost and her fellow health ministers, along with federal, provincial, and territorial officials, are working together to advance a vaccine strategy. They continue to meet regularly to share information and to ensure a coordinated approach as we work towards approval of candidate vaccines. Yukon health officials have been preparing a vaccination plan for the territory. This includes identifying storage space, the number of required doses, staffing requirements, and plans for distribution. We anticipate approved vaccines will be available in early 2021. There are still many issues to be worked out, and vaccines still need to be approved by Health Canada. We will continue to share information as soon as it becomes available. I encourage all Yukoners to be patient, to continue to practice the Safe Six, and wear a mask. We need you now more than ever. You can always find the most up-to-date information on yukon.ca. Now, the last thing that I want to touch on before I pass things over to Dr. Hanley has to do with the fact that we are in December. As we set our sights towards an unusual holiday season, I know many kids around the territory are wondering how their gifts might get here in light of the self-isolation requirements, and I have good news on that front. I can confirm that Santa is a critical worker, and that I know that Dr. Hanley and his team have been working very closely with his counterparts in the North Pole. With that, I'll turn things off to Dr. Hanley. Thank you. Masi Cho. Ganeshish.
Thank you, Premier Silver. Dr. Hanley.
Thank you, Premier, and thanks for listening to my recommendation as well. Good morning, bonjour, bon matin. Happy December. I hope everyone is doing well. I know there are many things in motion at the moment. We have outbreaks going on with a sharp increase in case numbers. We have the mask mandate, which some people welcome and others not so much. Canada as a whole is grappling with continually rising cases, hospitalizations, and deaths. It all feels as unsettling as rain in December. Our case count has, as the Premier indicated, doubled in the past 3 weeks, from 23 cases on November 10th to 47 cases as of this morning. And counting, we are likely to see more cases. So far, all cases investigated have been traceable back to a known case or cluster or are suspected to be linked. All recent cases are recovering well while at home in isolation, with 2 cases still in hospital. And YCDC is continuing with intense contact tracing. We don't know when this will end. We won't know when this will be over until we see at least a few weeks without further cases linked to this outbreak. And so far we have, despite extensive testing, not identified signals of community transmission. In other words, we're not seeing cases appearing in the community that are not connected to travel or to known cases. However, we haven't ruled it out. So for the time being, our approach is to pursue rigorous contact tracing and to test wisely. Wisely and widely. I thought it would be, at this point, worth reaffirming and focusing on what our general goals are with the pandemic, and particularly in this time of outbreak. And if we have goals, how do we get there? And our general approach is similar to Canada's as a whole: to prevent the harmful effects of COVID infection, to protect people and settings that are more vulnerable to COVID's threat, and to minimize the negative mental and physical effects caused by the COVID response. In other words, we're continually striving for the best balance of reducing COVID's threat while supporting the health of our people, whether that's mental, physical, spiritual, or overall health, and preventing harm to our society. So protecting the overall well-being. And more specifically, our goal is to contain COVID so that we can ideally prevent community transmission. And if we can't achieve that, we will strive to keep transmission to a minimal level while protecting our citizens, our elders, our communities, our healthcare and essential workers, and our healthcare system. And as we continue towards this present goal of containing the outbreak and preventing it from turning into more widespread disease, our approach is based on the following measures: carrying on with meticulous contact tracing, maintaining accessibility to testing to detect otherwise undetected disease. And we have increased our testing capacity recently by offering a more convenient way to get tested with the extended drive-through testing center. And so if you are symptomatic, you can drop into the drive-through and seek testing. We're also continuing to identify sites where transmission may have occurred. And these core public health measures are in addition to what we need to do as a population to prevent transmission, including the Safe 6 and masking, and I will go over these in some detail later. So I think everyone understands why we want to test and contact trace. But why the public notifications, and isn't that just raising the alarm too high? Well, we know well that COVID-19 can be spread from people who have symptoms that may be mild enough that they are not recognized as something potentially serious. Or it can be spread in that period before symptoms develop. So without knowing, these individuals can be out and about in the community in that 2 or 3 day pre-symptomatic period. And every time that we interview a positive case, the nurses try to suss out where the individual was while infectious. Sometimes that may involve a setting where there's been significant mixing with a member of the public. Sometimes these situations are so transient, a few minutes in a gas station or convenience store, that they're not significant ways for COVID to spread. But sometimes when the durations are longer and perhaps other conditions prevail as well, maybe more crowded venues, maybe closer spacing, maybe absence of mask use, those are situations where we will post locations to notify potentially exposed members of the public. For that reason, we have to publicly provide information on where there may have been possible public exposures. And this is another strategy to find places where transmission may have occurred and therefore to find others who may have been infected. Therefore, if you were in one of the identified spots before the times or during the time specified, we ask you to self-monitor for 14 days from that visit. And if symptoms do present, to immediately isolate and seek testing. But otherwise, please consider these locations safe to frequent if they're open. All of these businesses are facing challenging times during a pandemic, and we have been working closely with all of them to help them operate in a safe manner. Now, this outbreak is not over, but we have already learned a lot. And there are significant lessons to be learned that we need to apply to further preventative measures now. And here's what we're seeing. People who are working or participating in activities while sick with symptoms. We see COVID infection being passed around in work settings or in other public settings where people are meeting and gathering outside household bubbles. So here is takeaway number 1. If you don't have any symptoms, if you have any symptoms at all, if you do have symptoms at all, stay home. Don't go to work. Don't go to the gym. Don't go to the grocery store or pick up a coffee. Many of our recent cases have arisen from transmission within a work setting. A sick staff member goes to work, infects a coworker, who then goes home and infects a family member, and so on. If you're sick, it's your responsibility to protect your partners and your friends and your partners at work, your family at home, and others that you associate with. So if you do get symptoms, what will you do? Will you continue to work and pick up groceries for dinner, or will you go home and stay away from others? You need to walk through this scenario ahead of time and be ready in case you do fall ill. If you have symptoms, even mild, you must avoid others and avoid public places. If you continue with your daily lives, you may be the reason that others become infected. So if there is one thing to take from today's briefing, please stay home if you're feeling sick. And this is critical to reducing the number of cases throughout the territory. Employers, please prepare for staff to be sick and ensure that both you and they know the supports that are in place for you, as the Premier mentioned. Check the website, phone, ask your colleagues. But staff and employees should never feel compelled or obligated to work while sick. As the Premier confirmed, the wearing of a non-medical mask is now mandatory in Yukon while in indoor public spaces. Everyone over the age of 5 will be required to wear a mask, and this mandate is enforceable under Civil Emergency Measures Act, meaning that Yukoners will be required to wear masks in spaces as defined in that order. And details, as always, are available on yukon.ca. The evidence is more compelling by the week. Masks do help us in situations where physical distancing may not be possible. While we can continue to socialize, go to work, and visit other public spaces if we're well, masks will give us yet one more layer of protection in addition to our Safe 6 measures. Masks help prevent the spread of a person's infectious respiratory droplets if that person is wearing a well-fitted non-medical mask. And remember that COVID can spread before symptoms occur. Masks can help us further protect ourselves and others, including those who are more vulnerable to COVID-19. Wearing a non-medical mask that properly covers your nose, mouth, and chin helps you reduce the risk of transmission of COVID-19 when you also follow the Safe 6. Remember, masks are not a substitute. They're an addition to all those measures that are already well known. It's important that you continue to physically distance and wash your hands and follow the other measures when applicable. For Yukoners who cannot afford or can't find a mask, Yukon government does plan for a limited time to make them available at public facilities. And please refer to yukon.ca for more information and guidance on the use of mandatory masks. These recent and ongoing outbreaks have led us, as they should, to think about what our risks are and what we're doing to diminish those risks. We need to have those difficult conversations about what extra societal measures may be needed, either now or if things get worse. In many ways, we have been relaxed or led into complacency as the risk of COVID has seemed something mostly outside our borders. But now there's no further room for minimizing the threat or denying it. COVID-19 is here, it's real, and it could get worse. I'm going to ask you to make some small sacrifices for a greater good. And by and large, there's nothing here that we have not already asked. It's just a matter of redoubling efforts to do what we should already be doing. First, if you can do so without disrupting workflow or service to others, please work from home. I ask that employers consider ways that they can support having some employees work from home where possible. And if you're unable to support this as an employer, please refer to yukon.ca for all the pandemic relief supports. Now, importantly, we are not going back into the shutdown phase that we faced 8 months ago. We want services to continue to run. We want clients to continue to get the services and care that they need. We want those important transactions still to occur. But at least to some extent, if we can make the workplaces a little less peopled and a little more spacious and carry on just as well, we will be in a better place. The second, and I've mentioned this already, do not work while you have symptoms. We've witnessed this occurring and contributing to COVID spread. We've seen it occur all over the world, and now we're witnessing it here in Yukon. Really, the only reason to have any symptoms and to remain working is that single runny nose that we highlighted in the traffic light guidance. Basically, anything else, you need to stay at home, stay away from others, self-isolate, and arrange for either a test or 10 days of self-isolation. Third, regarding your household or social bubble, let's take another look at those rules, and now we really need to stick to them. So stick to your social bubble in every setting. And your social bubble consists of people you live with or who regularly come into your household. Your social bubble can include one other household. Everyone in your household must be a part of that social bubble. And that's it. That's your bubble, like it or not. If you're in a shared household, you either form the bubble among you, or you have no shared facilities and no close interactions. This means that the household members you interact with are not having dinners with their neighbors or friends outside of this bubble. The bubble is designed to be small, but can include a maximum of 15 people. And remember, that's split between 2 households. So people you play sports with or work with, if they're not already in your social bubble, they are not part of your social bubble. So in these areas, you need to follow existing guidance, whether that's for contact sports, sports guidelines, or operational plans that you need to have set up for your workplace. And if you go out to restaurants or bars, please don't share tables with people outside of your bubble. The harsh reality for now is that you can only socialize with your friends in these settings when well spaced from each other. Sharing a table is unfortunately not one of those ways. We are seeing transmission of COVID-19 in multiple settings where indoor spaces are shared, whether at home, at work, or during leisure activities. It's vital that for the next few weeks we hunker down and reduce our outings and social gatherings outside of the household. We'll have to work a little bit harder these next few weeks, even months, and we will need to comply with the new guidelines, sticking closely to our household bubble and showing compassion where it's required. We're not alone in this battle, and as proud Yukoners, we can work together to slow the spread of this virus and ease the strain we're all feeling by investing in our efforts. I want to talk about the importance, as I've mentioned many times before, of confidentiality. And during these last few weeks, I'm sure we've all heard the constant swirl of rumors. We've released numerous cases that have been linked to specific locations. We need to remember that privacy is essential during a time like this. When people are sick with COVID-19, we want to avoid these individuals being named or blamed or ostracized because they became ill with the virus. Individuals diagnosed with COVID-19 are often dealing with an overwhelming amount of emotion and fear. On top of being ill, they don't need or want to be identified among their peers or their community. It's nobody's fault that COVID-19 is in our territory, but it's everyone's responsibility to stop it from spreading. COVID-19 will take any opportunity to infect. It is always knocking at our door, and it can infect anyone at any time. So please understand that and be sympathetic to others. For those who are presently fearful of contracting COVID-19, please, it may be helpful to remember the following. If you're identified as a primary contact, you will be reached out to by a nurse. If you're a secondary contact, in other words, if you've been in contact with someone who was at a place of exposure, please don't be alarmed. You can carry on with your life. And like anyone, if symptoms do occur, you can self-isolate and arrange for testing. If you have questions, you can call the COVID info line. If you have symptoms, you can call 811 or do the self-assessment online for testing. We will always try to help. And remember, no news is good news. Nurses at Yukon Communicable Disease Control or community nursing will directly advise any contact who may have been exposed to COVID-19. So three important areas to remember before I have a couple of closing remarks. So one is, if you're sick, stay away from others, and please don't participate in activities and don't go to work. The second is keeping your social bubble really to your household, that 1 or 2 household bubble. We really want to keep social activities within that bubble. And the third is, if you have an opportunity to work at home, please work at home. And all of these 3 things are in addition to the masking, the mandatory masking that comes into effect today. Now, sometimes I've shouted out to people or congratulated or thanked people, and I think it's always important to express gratitude to those many people who are involved in the COVID response. And that's whether it's our frontline public health people, community nursing, the people who work hard, so hard in long-term care, our frontline healthcare workers, the team that supports me, and all of the activities in the COVID response unit. But one group I wanted to shout out to today was our Yukon EMS folks for all that they do, whether in their everyday mission to be right there to help people when they're in need, or for the many other services they provide. And you may not realize that Yukon EMS assisted the COVID response unit and the Department of Health and Social Services in putting together the drive-through testing center basically overnight. EMS primary care paramedics now staff that center, as well as providing staff for the COVID testing and assessment center. They've worked long hours to support and provide Yukoners with additional testing options. Yukon EMS paramedics are also at the Whitehorse Emergency Shelter every day, helping out with a variety of healthcare services and assessments. EMS volunteers and staff are also all around Yukon communities, always standing by to help. So I want to thank all of the staff of Yukon EMS for being there for my team and for all Yukoners. And as the Premier said, there has been much speculation about how on earth Santa is going to make it to Yukon on Christmas night. And so I can add my assurance to young Yukoners that just as we're preparing in so many areas, we have not forgotten that Santa needs to get in, do what he needs to do, and get right out. So, in case you think you're getting away without being spied upon, I have, on my advice, been able to advise that Elf on the Shelf also will be receiving a special exemption from the self-isolation requirement. But this will be working self-isolation. The wily elf will be required to wear a mask when unable to physically distance from others. So keep an eye out for that shelf elf who will be watching how long you're washing your hands for and what else you are doing to stay safe. More importantly, Santa and all the reindeer have also been granted exemptions to be able to visit Yukon on the night of December 24th. I've heard something about immunity. I've also heard that they may be getting that new Russian vaccine on the way over here. But you can't be sure they're going to be immune. But as the Premier says, since they're critical workers, we have given them all the advice to help them stay safe while delivering their goods. So remember, they could arrive at any time during the night, and you must not peek. I know you want to check out Santa's mask and how it fits over that beard, or how Rudolph's mask could possibly fit over that red nose. But you do need to give them the space to do their job safely and move on to all the other kids. That's all for my update. Thank you. Remember to take care of each other and stay well. Masicho. Merci.
Thank you, Dr. Hanley. We'll now go to the phone lines, and we'll start with John from CKRW.
Hi, Dr. Hanley. I was wondering if maybe you could clarify as to what a good non-medical mask would be constructed out of, material-wise, thickness, and maybe if you're privy to the info, where some people might be able to get one.
Yeah. You know, we have just finished some guidance that covers all of those aspects. So there is the order itself, which says basically who, you know, how you have to wear a mask, where you have to wear a mask, and what the exemptions are. And then there's a guidance which goes more into the materials, but really a well-fitting mask, good sturdy cloth materials, 2 or 3 layer. 3 layers is ideal. 2 layers is also fine. Those are some of the highlights. Some guidance is also provided with some video footage of how to properly take on and take off the mask, how to clean it, and all of those really caring and nurturing for your mask. There is also there will be, I think, more specific information on where to get masks when you're unable to access them or have difficulty finding them, and those are going to be at a number of locations. And I don't have specifics on that.
I would just add, and I know that Dr. Hanley mentioned it in his opening comments as well, for a limited time, masks will be made available at public facilities throughout the Yukon Hospital Corporation's PPE supply chain, with an estimated maximum of around 200,000 masks being distributed. Now, priority of these masks that the corporation is making available will be for those who are the most vulnerable or have to have access to masks, but they will be made available to all Yukoners to remove any real or perceived access barriers. Masks will also be provided to municipalities, First Nations, territorial government offices upon requests, and some First Nations governments have already been provided non-medical masks upon request. Again, with the type of mask, I think Dr. Hanley nailed it, but 2 layers or 3, even great as well, tightly woven fabrics, such as cottons or linen. A third middle layer should be of a filtered fabric type, if possible, and large enough to completely cover the nose, mouth, and chin.
Thank you. John, do you have a follow-up question?
I do. This morning, while getting my coffee, I noticed a number of patrons in a coffee shop. I won't mention the name just to not ostracize the business. Were not wearing their masks, and today was the start of the mandate. My question surrounds the idea of enforcement, fines to go with non-compliance for the mask mandate, as well as, I guess, what exactly will enforcement look like?
Yeah, sure.
Maybe I'll start and the Premier can follow up. I know the Premier carries the big stick, so. This is the first day. So we recognize that it's, even though I am incredibly impressed by the level of uptake in the population. And just walking through downtown yesterday, I was noticing the even outside, the degree of uptake of mask use was astounding. So I think, let's give us a chance to adapt to mask use in the variety of settings that are spelled out in the order. So, there will be, I think we will see increasing uptake and a continued increase of uptake. And really the goal is to have as close to 100% of the population wearing masks as possible, with some of those exemptions for recognized and supported for people who, for a small variety of reasons, will not be able to wear masks. Having said all that, then so it's give some time. There's some habit forming to happen. There's education. There's availability and accessibility. All of those are really important to reinforce mask usage. Enforcement is there. It's not in my mind the first priority, and I think it would be a big mistake to go running around after everyone on the first day who's not wearing a mask. So, but there are enforcement mechanisms written into the order, so that there is a fine possible for non-compliance with mask use if there can't be reasonable verification of an exemption for that individual.
Premier Silver?
Yeah, thanks, Dr. Hanley. I completely agree with the strategy. You know, we've been talking for a few weeks now about the inevitability of masks. We've also been talking about the fact that we really want to see an educational campaign as opposed to an enforcement campaign, especially in the first couple of days. We know that Yukoners want to do the right thing. I know that the majority of Yukoners are on board to protect other Yukoners. Yukoners want to make sure that they're not responsible for spread. And so, you know, we will be encouraging compliance to begin with. And we are going to be enforcing the use of masks with fines or penalties, but that's a last resort at this point. There is a ministerial order that will be enforceable under the Civil Emergency Measures Act. But the primary means of compliance will be through education, awareness, and support. Again, if it does get to a fine, then the fine for not wearing a mask when required to is a fine of up to $500. Sanctions would only be used in egregious scenarios of non-compliance. A customer, like you described, or a visitor could be refused entry of service if they're not wearing a mask as well, but there is, under Civil Emergency Measures Act, the ability for the government to enforce fines.
Thank you. We'll move now to Tim from Whitehorse Star.
Yes, thank you. First question I'd like to ask is if you could go over the medical exemptions for not wearing a mask.
Yeah, do you want to do that?
Yeah, and I don't have them in front of me, but there are some. So there is a list, and there are some like facial deformities. There are some areas where breathing with conditions that make breathing difficult, and there are some. Mental health reasons. There are people with anxiety, for example, or other mental health conditions, kind of claustrophobic tendencies, where wearing a mask is just very difficult. So I think those are the main categories, and there may be another couple that I'm forgetting.
And just in terms of exemptions in general, outside of medical exemptions, again, we mentioned children under the age of 5 will be not required. Other exemptions, as the doctor references, people with medical conditions, which prevent them from wearing masks, but also people who are participating in sports, in private areas, in long-term care homes, while eating or drinking at public restaurants will also not be required. The current recommendations for schools will remain in place. Those recommendations are that students age 10 and older, so grade 4 and up, wear non-medical masks in school settings where physical distancing cannot be maintained. And this order also does not apply to workers who do not offer services to the public. For those places, individual workplace policies will apply.
Thank you. Do you have a follow-up, Tim?
Yes, I do. Are you expecting much active resistance or pushback to the mandatory mask bylaw?
I mean, you're always going to get folks that don't want to be part of the solution. You know, I think, you know, the conversations Dr. Hanley and I have been having for 9 months now, going on 9 months now, you know, watching acceptability of masks internationally, nationally, and locally, so much has changed. So much has changed in the last month as well, as far as acceptability in public spaces. And so, sure, you're going to see, as you said, as the previous reporter said, saw it just this morning, people going into places not wearing a mask. But we believe that the general population, most people, want us to get over this. You know, COVID fatigue for everybody, conversations about vaccines really puts us in this precarious place where, you know, Yukoners are not living in their gestalt. You know, they're looking forward to a future where all this can be behind us. And so now more than ever, it's really important for all those Yukoners who care about the safety of our elders, who care about the safety of people with underlying health considerations, and just the general population. Now we need Yukoners to dig deep. You know, we're kind of in the 7th inning stretch right now, and so we really need to maintain that diligence. I think that the Chief Medical Officer of Health and his team have done an extraordinary job of preparing Yukoners for this inevitability. And here we go with just another part of the new normal. And we're really encouraged by the amount of masks use that I have been seeing and that we've been seeing. But yeah, you're going to get some folks that are obviously not going to commit to this.
Thank you. We'll move now to Claudiane, Radio-Canada.
Possible de me dire en français, donc, les règles entourant le port du masque, mais les mesures aussi pour les faire appliquer, s'il y aura des contraventions, etc. Ouais.
Could you please repeat in French what are the rules for wearing masks and what kind of measures have been taken to ensure that people will wear them?
Oui, je vais essayer à la mémoire. Donc, les masques sont maintenant, à partir d'aujourd'hui, sont obligatoires dans les endroits publics. Donc, dans les endroits comme où on a où les gens se mélangent. Par exemple, dans les bâtiments, les édifices publics, dans les endroits de foyers de foyers ou de foyers de travail où on reçoit des gens du public dans les cliniques, dans les endroits d'activité, dans tous les endroits où on peut recevoir ou mélanger les gens. Donc, mais il y a aussi les exceptions. Par exemple, moi maintenant devant un microphone qui adresse le public, c'est une exception aussi pendant les activités sportives. Donc avant le sport et après, c'est obligatoire, mais pendant l'activité, c'est permis de pas porter la masque. Et dans certains autres endroits, dans le lieu de travail, si on est situé dans le bureau ou dans une salle de réunion, ce n'est pas obligatoire, mais dans les endroits communs, encore, c'est maintenant obligatoire. Et puis, il y a les exceptions médicales qui sont peu, mais par exemple, les déformités faciales, des conditions de santé mentale, comme l'anxiété, et certaines autres conditions respiratoires où ça porte plus de difficultés de respirer quand on porte un masque. Donc, il y a quelques exceptions. Et aussi, on veut renforcer l'éducation, d'avoir un temps pour les gens de s'habituer à ces nouvelles règles. Et finalement, il y a la possibilité d'avoir une amende jusqu'aux $500 plutôt pour les situations exceptionnelles où les gens refusent malgré tout l'encouragement de porter un masque.
Prochaine question, Claudiane.
Vous avez parlé beaucoup de rester à la maison quand on a des symptômes, de ne pas aller au travail. Est-ce que c'est là où on a vu la plupart des cas récemment? Est-ce que c'est au travail?
So you mentioned that it's important to stay home when you have symptoms. Is it related to the latest cases? Is it at the workplace that most of these cases have appeared at this point?
Oui, je peux pas dire la plupart, mais il y a, c'est impressionnant qu'il y a certains cas où on a témoigné la transmission de virus dans les endroits de travail. et plus d'une fois. Et puis, ça a répandu à la maison. Donc, c'est une situation même avec ces vingtaines de cas, on a vu plus d'une fois, plusieurs fois, cette méthode de transmission. Donc, c'est pour ça. Et c'est pas unique, naturellement, c'est pas unique au Yukon. Donc, c'est plutôt qu'on voit maintenant au Yukon ce qu'on a témoigné dans d'autres parties du Canada. Et donc, c'est réemphasisé de constater fortement que c'est vraiment un risque pour transmission, c'est de porter l'infection dans les lieux de travail.
Thank you. I won't ask you to repeat that. You've already said it in English. We'll move to Beth Layton from Canadian Press. I'm going to assume that Beth has no questions. We'll move on to Marine, Aurore Boréale.
Oui, merci. Pourriez-vous répéter en français les mesures qui sont associées au Père Noël?
So could you please repeat in French what measures have been taken regarding Santa Claus?
Je vais aussi essayer, oui, avec plaisir. Donc, je sais qu'il y a beaucoup de spéculations sur la façon dont le Père Noël va se rendre au Yukon pendant la nuit de Noël. Mais je voulais assurer aux jeunes Yukonais que, alors que nous nous préparons dans n'importe quel domaine pour le COVID, nous n'avons pas oublié que le Père Noël doit entrer, faire ce qu'il doit faire et sortir immédiatement. Et aussi, on va rassurer que le Elf on the Shelf aussi tienne une exemption spéciale pour continuer de garder un œil sur les enfants pour vérifier que toutes les mesures de sanitation sont suivies. Mais le Père Noël et tous les reines ont également obtenu des exemptions pour pouvoir visiter le Yukon pendant la nuit du 24 décembre. Et j'ai même entendu des rumeurs d'immunité et même entendu dire qu'ils recevraient ce nouveau vaccin russe en route. Mais on n'est jamais sûr. Mais comme ils sont des travailleurs critiques, nous leur avons donné les conseils pour les aider à rester en sécurité tout en livrant les marchandises. Et rappelez-vous, ils peuvent arriver à tout moment de la nuit et vous ne devez pas y jeter un œil. Je sais que vous voulez voir le masque du Père Noël et comment il s'adapte à cette barbe et comment le masque de Rudolph pourrait éventuellement s'adapter à ce nez rouge. Mais vous devez leur donner l'espace nécessaire pour faire le travail en toute sécurité et passer à tous les autres enfants qui l'ont besoin. J'espère que ça suffit.
Avez-vous une autre question, Marine?
Oui, merci. Merci d'avoir répété en français. Est-ce que ça signifie que les traditionnelles photos avec le Père Noël cette année vont être remises en question?
Does it mean that this year the traditional pictures taken with Santa are not going to happen this year?
Oui, c'est une bonne question. Et donc, tout suivant les règles, mais j'ai l'impression que les gens s'adaptent avec d'innovation toujours. Et un exemple, c'est j'ai entendu pour mes enfants qui avaient les photos à l'école, qu'on va tous les photos individuelles et puis on va les photoshopper pour faire une photo de groupe de la classe. Donc j'imagine il y a des moyens peut-être pour faire des photos ensemble sans être ensemble.
I will ask you to
say,
repeat that
okay.
in English, please.
The question about spacing and Santa photos, the spacing will have to be observed, and all the guidelines, unfortunately. So there may be not the opportunity to have a close encounter or a hug with Santa. However, there are methods, and I was just speaking about my kids who just had their school photos done, and instead of the traditional class photo, they were going to just Photoshop the individual photos into one class shoot. So there are always these opportunities for innovation.
Thank you. We'll move now to Haley, Yukon News.
Thank you. I had a question for Dr. Hanley. I'm sure this was covered earlier in the pandemic, but I'm hearing more people asking questions about it. So much of the advice for like contact tracing or being in an area has to do with waiting to see symptoms. Is asymptomatic transfer of the virus before you see symptoms, is that a concern at all?
Absolutely, it's a great question, and absolutely it is a concern, and that factors into how contact tracing is carried out, and even how our public notifications are carried out. So we always build in a pre-symptomatic. We always assume an infectious period up to 3 days before symptom onset, and so it's almost like our safety factor or precautionary factor to recognize that infectivity occurs in those up to 3 days. I mean, it's really probably 2 to 2.5 days. We now have gone to 3 days as our usual approach. And again, just building in that safety factor so that we are looking for contacts not just at the time of symptom onset, but in those days before. And the same with our notifications, recognizing that people may have been in those places before, if they've been in those places before symptom onset, we count those as potential exposures if they are in that 2 to 3 day period beforehand.
Thank you. Next question, Haley.
Thank you. Yes, my other question, it was sort of touched on, but when it comes to household bubbles, obviously it's much easier if you sort of have a nuclear family, maybe you've got 2 adults and a kid living in a house. When it's situations where 4 adults might be roommates living together and then there's significant others with other roommate households, could you just give a little more practical advice for sort of the best practices when you've got those shared households, how to build a reasonable bubble?
Yeah, I'll try. And it's, again, I think it's a mixture of being really prudent and common sense and recognizing what you're starting with. So if you, there's no doubt that a shared household where you have, for instance, a group of young adults who are all working in different places, you're already looking at a potentially risky scenario. So it is important to establish at the beginning what the understanding is within that household. Are you having four people, for instance, who have separate bathrooms and separate lives from each other, and rules about using the kitchen and spacing within the kitchen, and as I indicated briefly, no sharing of facilities, so that you're really setting yourselves up to be living completely separate lives, and that does happen. Or are you actually forming a social bubble? So there are your friends, and you're deciding to make that your social bubble. That means then that you are limiting your bubble outside. So that really is your bubble. Now, you could you could entertain 1 or 2 others into that bubble. This is not where the 15 applies. The 15 is really to recognize so 2 households where you might have 2 large families, a family of 8 and a family of 7, and they can deliberately form that bubble. So I think we haven't spelled out every detail in the guidance, but I think it's really being aware of the potential interactions that go beyond the household. So if you have those 4 people within a household who want to be a social bubble and they're all working in different places, you're already introducing other risks of social interactions. The preferred way would be to keep that bubble really small, whether that's just the household, maybe 1 or 2 other close friends, and then that's it. And then so then there's no other bubble. If you are in workplace, you're observing very carefully all of the workplace guidances that exist, and the same for sports and activities and other areas. So I think probably the most important thing: read the guidance and be very deliberate about what you are and how you define yourselves.
Thank you. We had a bit of a phone glitch, so I'm going to go back. Beth from Canadian Press, do you have any questions? And she's still not there, so thank you. I'd like to thank everyone for their time today. Our next COVID-19 update will take place Tuesday, December 8th at 9:30 a.m.